The truth about root canals. I'm Dr. Ellie, and in this video, we're going to talk about things that you may not have been told about root canals. Have you been told you need a root canal? Maybe you have, maybe you know what it is, but so many people sit there without knowing what a root canal is. And there's a lot of fear these days. There was a documentary that was up on the internet for a short while. I actually knew the people who were involved in that, and there was a lot of editing that was a little bit upsetting because it's very easy to get the wrong impression of a root canal. That's the first thing, to misunderstand the value of having a root canal if you have a dead tooth, the dangers of a root canal, and what are your other options, and compare and contrast those options. It's a very important decision, so I want to run through it a little bit today. So if you're told you need a root canal, what's happened to your tooth? You may not even have a big cavity in it, so what's occurred? Inside your tooth are live parts. There's a live part right in the center, and it runs all the way down the roots. All of this here is full of cells and blood vessels and nerves, and this is basically the life of your tooth is in the inside of it. Now, every time a tooth is damaged, and it can be a hit from the outside, that's one way a tooth is damaged, and you don't always see immediately the fact that your tooth has died. You see, when you have an accident, say you're in a car accident, this blood supply that goes down your roots can get severed. It gets cut off. And then the problem is that this tooth won't have a proper blood supply, and the space or the place where all this live tissue was actually dies, and bacteria can get into this empty space and make it their home. And all of this procedure, the dying of the tooth, the replacement with bad bacteria, that can take up to 10 years before you have an absolute problem. And the problem is that all this space, the pulp, the inside of the tooth, has now become hugely infected. And there's nowhere for the infection to go. It's bubbling, it's got liquids, it's got bad bacteria producing toxins. The whole of this thing is on fire. That's when your tooth is painful. You bite on it and it feels painful. And that's because there's so much pressure buildup inside the tooth. And if there's no way for it to get out, it will actually burst like a volcano into the bone area at the bottom of your tooth. That's why a dead tooth that forms an abscess is not only so dangerous, but it's so painful. So you go to the dentist and you say that you have a tooth that you can't bite on. Or maybe it didn't burst out, it just has died quietly and without so much infection. Then this tooth might turn a different color. It might turn gray or black completely. The whole of the color of the tooth will become darkened. So your dentist tells you you need a root canal. What is a root canal? Well, a root canal will be a process that a dentist who is specialized in this treatment, and I would always recommend you go to an endodontist. Endo means inside, and dontist, and inside dentist. They want to clean out all this inside area. And they'll do it by making a hole in the top of your tooth, and they'll go through that hole and literally clean out so that this entire area is now clean. There's no more bacteria, there's no more blood supply, there's nothing. And your endodontist will fill, instead of all this being bad, this will all now be clean, and your endodontist will put a filling in this space on the inside of your tooth. In the 1980s, regular dentists started doing root canals. It was the beginning of root canals. Prior to that, very few people ever did them. And the people who did were usually very expert, and they used silver. I have one from when I was at dental school. I put myself in as a candidate for an examination, the final exams, and this senior actually failed his exam because he drilled into the inside of my tooth. When that happens, automatically the tooth is going to die. They filled my tooth with silver, and it's still there and it's perfect. But in the 1980s, silver was very expensive. So root canals were done with plastic and very toxic materials. And they didn't have the equipment or the magnification to know what they were doing. And many of these root canals were poorly done. And it gave root canals a very bad name. There have been so many advances in the world of endodontics. And today, an endodontist will be able to go in here, do a really nice cleanup of all the problems inside the tooth, and then fill it with a really good filling right to the very end of each root. And then you can maintain that tooth. And here's the interesting part. This is what I want to teach you about because it's not understood or well known. See, many people will say, oh, take out the tooth and put an implant in there. And I would advise you to think very, very carefully before you do that. If you can have a good root canal that keeps your tooth safe, it is dead, yes, but it is no more dead than a fingernail. It's still attached to your body. It's attached, in fact, by all these little fibers all the way around. And these fibers are called the periodontal ligament. And they go from the bone of the jaw to the side wall of the root of your tooth. Everywhere. It's not just two-dimensional. Think of this, it's all around the roots of all this, the roots that are part of this tooth. There are often 3 roots for a molar, maybe even 4. All these tiny hairs, they are 1/100th the width of the hair on your head. So they are tiny, tiny little fibers, and they should not be forgotten because it transpires that as we bite down on a tooth and we stimulate by biting down these little hairs, they have a connection to the nerves in our brain. And when the brain feels the pressure, our brain releases something called orexin. And orexin actually is a hormone-type substance that helps your thinking, your decision-making. It's a very important part of your brain. And so we don't want to give up this orexin unless it's really necessary. This is why I would advise you to really consider the value of keeping a well-filled, even though it may be dead. It's not like something, it's not a sliver in your finger. This is a natural way to retain a tooth by getting rid of the infection. And just as you would get rid of an infection in a cavity, you clean up the area and you put in a filling. The only difference here is that the endodontist has cleaned up further into the tooth and put in a filling. There's really very little difference except that the nerves and the blood supply were involved, but there were nerves and there were cells involved in your filling too, in the sense that dentin has cells that are alive, at least parts of cells that are alive in the dentin. So it really is a filling that goes through the root, and this would allow you to keep this periodontal ligament and its nervous attachment, as it were, to the brain. We know that when people lose all their teeth, particularly women, there are studies to show it can affect cognitive function. So taking out teeth needs to be done with great concern and thought. The alternative is to put in an implant. And one of the things that people don't realize is that an implant does not have these fibers. There is no periodontal ligament for an implant. When an implant is basically a screw, similar to the screw in your toolkit, and it is literally screwed into the bone, and then the fake tooth is screwed onto the top of it. It's pure mechanics. There is none of this beautiful natural attachment. And so you will not get any of these signals sent to your brain. And this is where we need to be assessing this. And with today's big push by a very lucrative industry, the implant industry, I think a lot of people are not necessarily considering their options. Before you have a tooth extracted, think about your periodontal ligament. But then, why have I got all these products here? Because keeping your periodontal ligament healthy is what my complete mouth care system really addresses. It's one of the things. It keeps your whole mouth healthy. But this periodontal ligament is so important. I teach gum massage with the right kind of toothbrushes. I teach this 3-rinse system, specific mouthwash. I am not sponsored by any of these companies that make these oral care products, but I recommend the use of them in a specific order because it will prevent plaque from forming. That happens with xylitol. Yes, this is my company, Zellies, but other xylitol, if you're in other parts of the world, can work just as well. And then the mouthwash system keeps all of the mouth and around the periodontal area healthy. This is equally important if you decide to have an implant, and maybe even more important because an implant doesn't have the same kind of seal around it that a normal tooth does. And implants are notorious for developing implantitis, which would be inflammation. Instead of these little fibers here, inflammation occurs all around the implant and then it fails. It is a very difficult, delicate connection to the liquids in your mouth and the bacteria in your mouth. And that is why it's so important to have a healthy mouth, ideally before you have an implant. And if you already have one, I would recommend get moving on my complete mouth care system. Massage your gums, use the sequence of products twice a day, and throughout the day have enough xylitol to keep your mouth plaque-free and full of healthy mouth bacteria.